So good evening, everybody, and thank you for joining us here tonight for part two of our National Teagasc Virtual Sheep Conference. My name is Philip Creighton, Teagasc Sheep Enterprise Leader based in Athenry, and I will be your host for this evening's event. The format of this evening's webinar will be similar to the first part of our conference, which took place on Tuesday evening. Again, we have two excellent papers to present to you tonight with a strong health focus, which hopefully you will find both relevant and informative. During the talks, can I encourage you to use the question and answer function at the bottom of your screen, type in your questions there, and then I will put those questions to the speakers on your behalf during the questions and answer session at the end of the conference this evening. So first up this evening, we welcome Dwayne Sheils. Dwayne, I might get you to start sharing your screen there while I go through some of the introductions. Dwayne is an educational officer based in Teagasc in Donegal, but is also in the final stages of his PhD studies under the supervision of Dr. Tim Keady and Dr. John Mee from Teagasc, and also Professor Cathy Dwyer from the University of Edinburgh and SRUC in Scotland. During his studies, Dwayne also had very close links with the Teagasc National Farm Survey Department and the regional veterinary labs. Dwayne's PhD studies are focused on the effects of maternal and neonate behaviours in or around lambing time and on lamb survival and subsequent performance. He's looking at some of the risk factors associated with and the causes of lamb mortality from late pregnancy right through to weaning. And Dwayne tonight will present his findings from these studies on the opportunities to reduce lamb mortality and thus increase flock productivity and profitability. So with that, I'll hand it over to you, Dwayne.
So thanks very much, Philip. Good evening, folks. My name is Dwayne Sheils. I'm an education officer here in Teagasc Donegal, and I'm also finishing a PhD on young lamb behaviour and lamb mortality. Tonight I'm going to look at opportunities to reduce lamb mortality, identifying risk factors and the causes. I'd like to acknowledge my co-authors, Professor Cathy Dwyer and Dr. Tim Keady. And we'll start off with an introduction into lamb mortality. So lamb mortality is a key factor influencing the number of lambs reared per ewe joined. A 3% reduction in lamb mortality is worth 10 million annually to the Irish sheep sector and would result in an extra 100,000 lambs surviving each year. So while litter size affects lamb mortality, data from a 12-year study in Athenry from Tim Keady, with a flock scanning on an average 2 lambs per ewe, consistently achieved 10% average mortality. So when litter size increases, so too does lamb mortality, and vice versa. When litter size drops, so too does lamb mortality. Significant reduction in lamb mortality is achievable, however, by identifying the underlying causes and targeting them causes specifically. So the paper I'm presenting tonight is reporting findings in 2 recent studies, which were undertaken at Athenry as part of my PhD. The first study was a post-mortem study evaluating the time and cause of lamb mortality over 2 years in the 3 flocks in Athenry, and I'd like to acknowledge the regional veterinary lab staff for their work in this study. The second was a comprehensive risk assessment survey identifying the risk factors and management practices implemented in farms to reduce lamb mortality. This was done in conjunction with the National Farm Survey. We'll look at then when lamb mortality occurs. So start off with when it occurs. We know most of it occurs in the first week of life. 43% of total mortality occurred at birth, a further 15% from birth to 24 hours, 16% from day 1 to 3, and 6% from day 4 to 7. The remaining 20% of mortality occurred from day 7 to weaning. So in other words, 43% of all lambs that died are dead before they hit the ground at all, and 3/4 of the lambs that died within the first 3 days. So this is where the most opportunity is to improve lamb mortality. That's the greatest risk period. We're seeing there when it occurs. So we're looking at what are the main causes of lamb mortality. Reduction in lamb mortality are difficult until them major causes are identified, and a post-mortem is the best method to capture this information. So looking at the table or the graph here, we see that infection and dystocia are the main causes. They account for over half of all mortality. Infection on its own accounts for 32%, dystocia for 20. A diagnosis cannot be reached for 19% of the lambs. Other causes then, not sure, anoxia, so lambs suffocating or lambs ingesting fluid during the birth, Hypothermia, lambs getting cold and dying due to hypothermia or starvation, 14%. No necropsy complete or no test complete for 6% of them. And accidents accounted for 5%, and genital defects for 4%. So we can see that, as I said, infection, dystocia, they are the main causes, and most of the causes in this table, they're potentially preventable with best management practices that we'll discuss in a minute. So in the previous two graphs, we've seen the causes and the time of lamb mortality. This slide now we're looking at what are the main causes at each particular time point, when are the highest risk periods for each cause of mortality, and how does this mortality vary with age. So you can see that dystocia is the main cause, or dystocia or difficult births, so problems during the birthing process was the main cause of death in stillborn lambs. It accounted for 37% of them. This 37%, it was 80% of all the dystocia cases. So of all the lambs that died due to dystocia, 80% of them died at stillbirth. However, there's still 20% in there that we can see they were born alive, but they were injured in the process. They either broken ribs or trauma and died subsequently. 15% of the lambs then, from birth to 24 hours, 15% of these lambs died due to accidents. This accounts for 45% of all accidents. So it kind of highlights here that we need to ensure individual lambing pens are of adequate size, depending on litter size, and we must reduce the risk of accidents in this period. Looking at infections is kind of an interesting one there. Comparing it to other causes, infection increased as a cause of death as time went on. So you can see firstly, it's, I suppose, surprisingly high as stillborns. It's accounts for 17% of them lambs that died at or before weaning. This is predominantly abortions. If we go on across then through the rest of them, so lambs that died from birth to 24 hours, infection accounted for 23% of them lambs. Lambs that died from day 1 to 3, it accounted for 38% of them. From day 4 to 7, infection accounted for 52% of them. And day 7 to 100, so from 1 week to weaning, infection accounted for 61% of them deaths. So I suppose that highlights then the importance of using quality colostrum, which we'll talk about in a minute, increasing lambs' immunity, good worming practices to reduce enteritis, and a good clostridial vaccination program. So just one final point in that is looking at the diagnosis not reached. 29% of the lambs that died as stillborns were due to had no diagnosis given. So this accounts for 66 or for 2%, for 2/3 of all the lambs that died that no diagnosis could be given. These were fresh, stillborn lambs. With all of these, so I said some of them were potentially preventable, other causes. These lambs that there's no diagnosis, these are a proportion of them lambs that are stillborn. We all have them, and there's no diagnosis reached. So as we see, finishing up on that slide, the cause of mortality varied with age. We can see for accidents, it reduced as time went on. For infection, it increased as time went on. So just as to highlighting when the main risk point is, or the risk period is for each particular cause, when we can pay the most attention to reduce them potential causes. Looking then back on infection. So infection, it was the main cause, I said earlier, accounting for 32% of mortality. I'll concentrate mainly on the current practices on Irish farms, and I'll describe practices associated with reducing this mortality. Firstly, I'll look at the management before lambing. So we'll talk about abortions here. These accounted for a large proportion of the infections that were dead at birth. To reduce the risk of abortion, the advice would be to keep a close flock where possible. If a ewe does abort, the ewe should first be isolated. Hygiene practices associated with aborted fetuses and placentas should be adhered to. So all aborted material removed, pen cleaned out, disinfected, and the suspect cases, so the placenta and the aborted fetus, sent for postmortem. If a problem is then confirmed, a treatment plan must be put in place after seeking veterinary advice. So put in your treatment plan then, and a vaccination plan investigated for the next breeding season. Moving on to housing. In Ireland, ewes were housed for lambing on 75% of lowland farms. 90% of these used straw beds. So straw bed was the predominant bedding source used. We need to ensure there's good ventilation to keep infections out, and then a clean bed. So it starts off with that clean bed for ewes to lamb down on. Clean fresh straw will reduce navel infections, as this is the first thing the navel touches. It'll also prevent yolks, fleeces, and teats becoming soiled with feces and reduce infection through lamb's mouth, as this is the first thing they latch onto when attempting to suck. Looking then, I suppose, at the as stated previously, the main time of death where infection occurs is after lambing. We've seen that 39% of the infection occurs in the first week after lambing. So applying iodine to lamb's navels as soon as possible after lambing and ensuring yolks' teats are clean. This will reduce infection, as the navel and the mouth are the two main avenues for infection. While applying the iodine to lamb's navel is generally well implemented in farms, 80% of the farmers in the survey apply iodine. It's just looking at the types of iodine and I suppose the method of applying it. A strong 10% iodine solution that's found in the co-ops there, administered readily, putting lots of it on. Other options then is iodine and methylated spirits, 5% each, mixed 50-50. This has also been recommended by vets in some particular cases. So this helps dry out the navel and again reduce infection. Teat dipping, I suppose, is generally better than spraying a cover in the whole navel. But if you're spraying, ensure that you're covering both sides of the navel and especially around the base of it. Getting plenty of iodine around where the navel is in contact with the lamb or the skin. This is where the infection is the main risk period or site for the infection. Looking then, I suppose, at individual lambing pens, while they're great for mothering ewes and lambs up and the ewe-lamb bond, and for monitoring lambs in the first few days, we can pick up on any lambs that aren't doing right, any lambs that aren't sucking. We can see that 88% of farmers use these individual lamb pens, but there's 40% of farmers that don't disenclean. Only 40% of the farmers are cleaning and disinfecting after each show. So 60% of the farmers that aren't cleaning or disinfecting after each show. So ideally, the pen should be cleaned out and disinfected. Remove the straw, remove the feces, and especially the placenta of the cleaning. This harbors infection, or it encourages the growth of infection and bacteria, and give the pen a sweep clean. A good covering then of hydrated lime or Stalston powder. This prevents the buildup of moisture and bacteria. And a thick bed of straw, so 8 to 10 inches of straw. From the use of these lambing pens, we've seen that they have the benefit. They're great for mothering up and that. Farmers in the survey that used individual lambing pens reared an extra 0.13 lambs per ewe and at a higher gross margin of €17 per ewe. So they have the place definitely when used correctly. Colostrum then, we know that IgG transfer is very important for passive immunity. So lambs when they're born, they have no immunity at all. They require adequate quantities of quality colostrum in the first 24 hours. So the sooner the better after birth. So looking at that, 50 ml of colostrum per kilo of body weight as soon as possible after birth, but definitely within the first 6 hours. If the ewe then has no colostrum herself, they require 4 or 3 more subsequent feeds. So 4 feeds in total within the first 24 hours. So for example, a 5 kilo lamb requires 1 litre of colostrum. So that's 4 250 ml feeds of colostrum each feed in the first 24 hours. Farmers had a stored source of colostrum and the survey had lower mortality. So it's important to be prepared for some of them cases where we do have ewes that lamb down with no colostrum, to be prepared for it. Looking then at the source of it, ewe colostrum is most beneficial. So whether that be from the mother or from another ewe in your flock, you can give it fresh. Or if you have a ewe that lambs a single, you can milk that ewe out if she's surplus colostrum. It'll last for 24 hours in the fridge or chilled, or you can freeze in small quantities. This will facilitate thawing it out for individual lambs later, that you're not thawing out big batches, you're only thawing out small quantities. It should be thawed at body temperature, and again administered at body temperature. So you're not thawing it by boiling it or by putting it in a microwave, etc., to kill the protein. So you're thawing it at body temperature and administering it then to the lamb. A cow's colostrum is another natural source. However, if using cow's colostrum, it should be pulled from a number of cows. The survey then saw that artificial colostrum is used in 68% of the farms, and 10% of farmers use this as their only alternative source. So if they use no colostrum, artificial colostrum is used as the only alternative source. When using it, it's critical to check the IgG source and the concentration in that artificial colostrum, as many are either too low or they're not absorbable in newborn lambs. So when buying artificial colostrum, ensure you buy a colostrum substitute and not a colostrum supplement, as the IgG concentrations vary depending on each. previous studies have shown that little or no IgG transfer in newborn lambs that are fed only artificial colostrum. So while it is a great source of energy and to get lambs up to the feet and to suck, and also it's supposed to stretch the amount of natural colostrum you have, especially in larger litters. If you have triplets of that, you can stretch that by pulling the ewes natural colostrum with the artificial colostrum and giving to the lamb. So not giving artificial colostrum to one lamb and the ewes colostrum to two of them. They're milking the ewe and pulling the artificial and the ewes colostrum together. Final point there on farmers that use stomach tubes in the survey had a higher gross margin per ewe. However, good hygiene practices are required in using it. So when using stomach tubes, they should be washed and disinfected between each ewe between each lamb to prevent the spread of infection. Looking then at lamb birth weight. So lamb birth weight is a main cause of lamb mortality, whether that be small, light lambs dying due to hypothermia, or as seen in the post-mortem study, large lambs due to dystocia. So the optimum birth weight is dependent on litter size. A previous study at Athenry again by Hanner and Keady reported optimum birth weight of lambs born as singles to be 6 kilos, twins to be 5.6, and triplets to be 4.7. When I go above this optimum or above or below this optimum birth weight, it increases the incidence of mortality. This optimum birth weight then can be achieved with a good late pregnancy nutrition plan. It should be based on expected lamb weight, expected litter size, and forage quality, and then increasing concentrates accordingly. However, this involves applying rattle to rams at mating, scanning ewes, and analysing your silage or your forage. So the use of rattle at rams at joining and regularly changing the colour during the join period facilitates an accurate estimation of expected lambing date. And the survey found that 60% of farmers are rattling their rams. However, only 7% are changing this weekly. So the more often we change the rattle, the more accurate estimation of lambing date we have. Pregnancy scanning, it determines the expected litter size. So knowing the expected lambing date and the expected litter size facilitates grouping these ewes in late pregnancy for nutritional management. This, along with a forage analysis, gives an accurate indication of the requirement for concentrates and to develop that optimum nutrition plan late pregnancy. Finally, then we're looking at recording lamb deaths. 30% of farmers record lamb deaths. When they don't record lamb deaths, there's a tendency to underestimate on-farm mortality. So a simple whiteboard in the shed, lined out like the picture you see here, and a tick every time a lamb dies of a certain cause. Even better if we can give a record lamb age along with it. So a 0 for stillborn, a 2D for 2 days, or a 1W for 1 week. Tick the cause and then put the time beside it. This increases the awareness of problems in the farm and enables an action plan to prevent further losses. So we'll conclude then with a few take-home messages. 43% of lamb losses occur at or prior to birth. Infection and dystocia accounted for 52% of mortality. Both these causes are potentially preventable. Identifying the cause of mortality to implement the correct practices in order to reduce the risk of this mortality. Hygiene impacts on lamb mortality. So we've seen infection as the main cause, but if we apply iodine correctly to navels, clean and disinfect lamb pens after each ewe, and clean and disinfect lamb utensils, we will reduce the incidence of infection. Farmers that used individual lambing pens reared an additional 0.13 lambs per ewe joined and had an increased gross margin of 17 euros a ewe. Ensuring lambs receive adequate quantities of natural colostrum, so that's at 50 ml per kilo in the first 3 hours and 4 times in the first 24 hours if required. Dystocia can be reduced and then by lambs by a late pregnancy nutrition plan based on knowing expected litter size, expected lambing date, and a forage analysis. Recording lamb mortality will help identify these risk factors and allow an action plan to reduce further cases. So that's me finished up. Thanks very much, folks. I'll hand you back over to Philip there, and I'll be happy to answer any questions when you're finished up. Thank you.
Okay, so thanks very much for that, Dwayne. That was a great presentation. I'm sure there's going to be lots of questions on that, very practical, and with some great take-home messages there for farmers in the run-up to lambing now, a very topical subject to be covering at the moment. I will just remind people that if you haven't submitted your questions, you can continue to do so through the Q&A box at the bottom of your screen, and I will put those questions to Dwayne at the end of the session tonight. So moving on then, we'll give Dwayne a rest Next up tonight, we're delighted to be joined by Caroline Garvan from the Department of Agriculture. Caroline is a qualified vet who spent 12 years in veterinary practice in both the UK and Ireland, and worked in all aspects of veterinary medicine before she joined the Department of Agriculture, Food and Marine in 2007. In the Department of Agriculture, she works in the medicines area as a veterinary inspector and superintending veterinary inspector. She is now a superintendent veterinary inspector in the antimicrobial resistance section, where she is program manager for the delivery of the second national action plan to address antimicrobial resistance, as well as the delivery of the national antiparasitic resistant action plan. Caroline's presentation tonight is again very topical and is focused on the new Veterinary Medicines Regulations, which are coming into force in 2022, and its implications for us as sheep farmers. So Caroline, if I could ask you to start sharing your screen with us, and I'll hand over to you for your presentation, Caroline. Thank you.
Thanks very much, Philip, for the opportunity to be here this evening to talk to you all on what are some really important new rules or regulations coming down the track for sheep farmers and indeed for all farmers. I'm here tonight to talk to you specifically in relation to the Veterinary Medicines Regulations and the implications of these for sheep farmers. So I suppose just to put it in a little bit of context and where this legislation fits in, it's all part of really the European focus on the farm to fork strategy and this real emphasis on sustainability and how we produce our food in a sustainable way. This specific regulation, which is specific to veterinary medicines, seeks to promote better availability of veterinary medicines through, I suppose, harmonization of the supply chain. But I suppose from your perspective as sheep farmers, there's a very strong focus in this new regulation on antimicrobial resistance. And I'll talk about that in the next slide. There's also a particular focus on responsible prescribing by your vet, but also responsible use by yourselves. And there's also a reference to restricting certain antimicrobials to human use only. And this is to protect human health. A key driver in this legislation is to protect animal health and welfare, but also human health. So as I said, there's a huge human health focus in this legislation. And why is that? It is because we are now looking at animal health, human health, and indeed environmental health in the one sphere, under the one umbrella. And we talk about this One Health concept. And I think if anything has driven home the One Health concept, it is the COVID pandemic that we've lived through. And really it shows how intricately animal and human diseases are linked. And what they've shown is that 75% of all new human diseases in the last 25 years have come from animals. And I suppose the key follow on from this is we use the same disease treatments in humans and animals, in particular antimicrobials and in particular antibiotics. So this legislation is looking at animal health and welfare in the same context as protecting human health. So I suppose just to make you aware of, we have been working on this whole area of AMR, antimicrobial resistance, or specifically antibiotic resistance, since 2017 in this country, where we came together with the Department of Health and developed a national action plan. And key players in developing this national action plan were yourselves, farmers, the IFA, and obviously vets as well, Veterinary Ireland, came together and worked to develop actions around better use and responsible use of antibiotics. So back to the legislation. And what you need to know is what are the implications for yourselves as sheep farmers? What are the changes that come into place on the 28th of January? So really from tomorrow. And these are the changes that are applicable across all European member states, but specifically, what do they mean for your day-to-day work? I suppose the first thing to say is the prescriptions for antimicrobials will only be valid for 5 days. And when we talk about antimicrobials, what I mean is antibiotics, antifungals, and antiprotozoals. Antiprotozoals are the medicines that you use to treat things like coccidiosis, cryptosporosis, and also toxoplasma causing abortion. These are all protozoals. Then our antibiotics, as you'll be well familiar, we use to treat bacteria, so the likes of E. coli. And what this means is that your prescription currently, up till the 28th of January, would have been valid for 12 months. So you had 12 months to go and get your prescription dispensed. From next Friday, tomorrow, you will only have 5 days from which to get that prescription dispensed. Now, it doesn't mean that you can only treat the animals for 5 days. It means that you have 5 days from which to get the medicine. The treatment period will be whatever it is, whatever your vet has prescribed on the prescription, but there is an urgency, if you like, to get the prescription filled within 5 days. Now, all other prescription-only medicines will stay as being 12 months, so you will have 12 months to get all your other medicines, but for these antibiotics and the antiprotozoals and antifungals, you will only have 5 days to get your prescription dispensed. I suppose the other thing is there's a lot of changes in this legislation, in particular around veterinary behaviour and what vets can do. And this is, I suppose, to drive home, responsible use of antimicrobials and really to reduce the overall use of antimicrobials. So what this legislation is saying that vets now can only prescribe after a clinical examination of the animal or a proper assessment. Now, this does not mean that the vet has to come out every time you have a sick ewe or lamb, but the vet will have to make a judgment call as to when the appropriateness of prescribing. And this proper assessment, this has been, I suppose, reviewed by the Veterinary Council of Ireland, because all vets have to follow a professional code. And in that code, they have been advised as to what constitutes a proper assessment. So the Veterinary Council has said things like having records or having a proper conversation with the farmer. This will allow the vet to prescribe. So you do not have to have a clinical examination of every animal. But really, it's in everybody's interest that the vet has enough knowledge and so that they can prescribe properly, so that you get an effective disease treatment and a better outcome. But this legislation is being very tight on when a vet can prescribe. The other thing is vets have to be able to justify their prescribing. So they have to be able to demonstrate that it was correct to prescribe Oxytet or whatever for the sheep in question. So there's particular responsibilities coming on the vets, and this will obviously impact on yourselves. The other thing is they can only prescribe the amount required for the disease. This is to cut down, I suppose, on maybe overuse of antibiotics in particular. So they can only prescribe for the disease that is there and the amount needed to treat the disease. Now, this department will allow for a small quantity of medicines to be kept on your farm. And this is at the vet's discretion. The vet will decide how much you can keep on farm, but we are not trying to say you can't have any medicines on farm, because we understand the practicalities that you may need to treat an animal in the middle of the night or whatever. And so you do need, in order to protect sheep health and welfare, you will need to have a small quantity on your farm, but your vet will make that decision, because what we do not want is bottles and bottles of stuff being kept on farm, and the legislation does not allow for that. Okay, what other changes are going to happen? I suppose there's a particular focus on use of antibiotics to prevent disease. And what this legislation is saying that it is only in exceptional circumstances, so that you cannot, there may have been practices where it was routine to give a lamb a shot, maybe at birth of something. That is no longer allowed. It's only in exceptional circumstances where there's particular risk. And the same thing if you're treating a group of animals where one of them is sick, you have to have, the vet has to be able to justify that there's a high risk of spread of the disease amongst the rest of the pen of sheep, and also have a diagnosis. So very much looking to cut down on overuse and misuse of antibiotics. The other thing to mention is that I referenced the whole public health focus of this legislation, and there will be a list that will prohibit the use of certain antibiotics in animal health. Now, the likelihood is there's nothing on this list that we currently need to use in animal health, and this list will be focused on protecting animal health and welfare as well, but there will be a list drawn up of certain antibiotics that will be taken out of animal health completely. Now, then we move on to these HPCIAs, which is a long acronym for highest priority, critically important antimicrobials. So there are certain groups of antibiotics that are used as your we might call them the stronger antibiotics, but they are used when the first line hasn't worked. But these are the same antibiotics that are used in our hospitals as drugs of last resort in human health. And the message that is coming through now is that they cannot be used randomly in animal health. They cannot be used as first-line treatments. And there is a list of these particular antibiotics up on our website, DAFM, under gov.ie. There is a list there that outlines these antibiotics, which you can no longer expect as farmers that vets are going to prescribe them as first-line treatments. There are certain criteria vets have to follow. They have to do certain diagnostic testing before they can use them. And I suppose the reality is that, you know, your first-line treatments should be working in most cases, and there shouldn't be a need to use these stronger antibiotics. They're more expensive, but the bottom line is they are hugely dependent on in human health, and we have to keep them effective in human health by reducing their use in animal health. Okay, so I've talked a bit about responsible use of antimicrobials in sheep. And this is just a document that's there on that website, agriculture.gov.ie/AMR. And this was a document developed with our friends in Teagasc, with the IFA and with Veterinary Ireland. And it's a really nice document with specific information for sheep farmers. And it really outlines how you can, you know, better target your use of antibiotics on your farm, and I suppose cut down the expense of antibiotics, but having also better outcomes when you do need to use them. And what it does is it follows 6 principles that the 6 R's we call it. So you get the right veterinary diagnosis, so that you're relying on your veterinary diagnosis of the disease present, that you're treating the right animal. So you're treating the animal that actually has the disease with the right medicine. So if it's a viral pneumonia, there is no point in giving antibiotics because you're not going to kill the virus with an antibiotic. So it's all about giving the right medicine. And then crucial to any use of antibiotics is to give it at the right dose. So make sure you're not, if you're underdosing, you're not going to be effective in your disease treatment. If you're overdosing, you're wasting money and you're driving resistance. So giving the right dose and giving it for long enough. So following your prescription, because even if the sheep or the lamb is running around the shed, does not mean if you were to give it for 5 days, you give it for 5 days. And then you also correctly dispose of your antibiotics. So following those, it's all in that little document, just helps better, it will give you better use of your antibiotics, better outcomes, and, you know, just a better approach to controlling disease on your farm. So I've just flagged that document because it was developed by sheep farmers, and it does outline some really helpful strategies on how you can reduce your antibiotic use, focusing on disease prevention, the benefit of developing flock health plans, looking at your biosecurity, you know, particularly say when you're buying in sheep in terms of limiting lameness spread in the flock, your internal biosecurity, your disinfection, your hygiene, how, you know, vaccination, really what we need to do is move more to vaccines and reduce our antibiotic use. So, you know, the value of vaccines in terms of pneumonia or abortion, and basically how you can improve your husbandry on your farm. Because one of the key points in the new legislation is that antimicrobials shall not be used routinely to compensate for poor animal husbandry, poor farm management. So there's a huge focus on how food is now being produced, how animals are being reared across the globe, but particularly in Europe. And so this focus on using them responsibly and only when necessary. Then the last change I want to mention is in relation to our drenches, our porons, our doses. There is a significant change happening, and it's happening on the 1st of June. So the 28th of January, tomorrow, for your antimicrobials. But from the 1st of June, all your wormers, your drenches, your doses will require a prescription. So this is a significant change. And why is this happening? This is happening because, I suppose, of the development of antiparasitic resistance. So the same way bacteria become resistant to antibiotics, the parasites are now showing resistance to the wormers, the anthelminthics, the drenches. And it's because of this resistance, they have been upgraded, if you like, to being prescription-only medicines. So you can only buy them when you have a prescription from your vet. And that is going to happen from the 1st of June of this year. And the other big change is that from the 1st of June, all vets will be issuing prescriptions electronically. So there will no longer be paper prescriptions. We are developing a national electronic veterinary prescribing system. This system will be launched next Monday, I think it's the 30th of January, and it's free, or should I say, the vets can use it from that point onward to test it out. But from the 1st of June, all their prescriptions will have to issue electronically. So what does that mean for you? It means from that date, you will be getting your prescriptions by way of an email and a text message. So you will get a code which will link you to that prescription. And then when you want to get the prescription filled, you have a choice of going to your vet or else go to your pharmacy or your licensed merchant, your co-op. You bring the prescription there and they then can view that prescription and dispense it as they normally would. So everything is going online. I understand there'll be concerns about this and how it's going to operate, and it will take time to bed in, but we are working with all the organizations to try and make this transition as seamless as possible. I suppose the other thing to say is your prescription for your antiparasitic, your wormer, will be valid for 12 months. So you have 12 months to get it filled, part filled, whatever way you want to buy the products, you have 12 months in which to do it. And then the last thing I want to highlight, on foot of all of these changes, the department is rolling out what we call a TASA. It's a targeted animal service, advisory service, on animal health. And you may have participated in these in other spheres, but we are rolling out a parasite TASA for all farmers, for beef, dairy, sheep farmers. It is free of charge. There is no cost to you. And what this means is that you would go to your vet. The vet has to be trained, and the training has started already. You go to the vet and the vet will come out and do a visit on your farm. I think it's a 2-hour visit on your farm. Look at your current parasite control strategies, what you've been using in the past, when do you dose, how you manage your grassland, what systems you have on your farm in terms of treating the animals. Do you treat them all? Do you just treat the young? Do you treat the ewes? They will look at all that. They will then put together 3 recommendations on how to better control parasites in your flock. And there will also be 2 fecal egg counts done to look at, say, the level of parasites in your flock. And then a follow-on test will be able to look and see how effective is the dose or the drench that you're currently using. So this is a scheme that's being rolled out this year, and we would really encourage everyone to get involved, to partake of it. As I said, it's a free service. It will help improve your use of antiparasitics on your farm, and it will drive down the level of resistance, because we do know anecdotally that there's quite a lot of resistance out there, particularly in our sheep flocks. And you may well be using something that is absolutely of no benefit, that it's not killing the worms at all. So this again should help, drive better productivity, better sustainability in your flock. So that's a quick run through, and there is a paper that we've included in the conference papers that goes into a little bit more detail on this regulation. There are big changes required, and as I said, the key driver is human health, but also keeping these antibiotics working for sheep as well. So animal health and welfare is also important. But what it's really driving at is changing our thinking and our behavior on how we use veterinary medicines. And really, this is in everyone's interests. It's promoting sustainable use. So having, medicines that will work into the future, because we all would like to think when we go into hospital that the antibiotics going to work. And, the reality is not all of them are now. And, we have to keep that in mind. We have to keep, I suppose, our systems of production sustainable. And really the key thing is to keep our animals healthier. By optimizing sheep health, you will reduce your use of these medicines. You will have better outcomes at an economic level, and you will also have better outcomes down the line for human health. So lots of changes coming through, and I hope I haven't confused you. I hope I've highlighted the key ones. Quite happy to take questions after all the presentations are finished, but for the moment, I'll hand back over to Philip. Thank you.
Okay. Thanks very much, Caroline. very good presentation. Thanks very much for that. So we're going to get into the questions and answers now. Because I've been very busy. I'm flooded with questions here, so we'll try and get through as many as we can. Look, we've tried to group together similar questions. So look, if your exact question isn't asked, I apologise for that. But we're going to try and get to as many of the topics raised as we can. So we'll give you a little bit of a break, Caroline. Dwayne, we're going to go to you first. A lot of questions again. A good reflection of the content of the talk, I suppose, and you know, very practical messages there. I suppose the first one we'll kick off with is could you elaborate a little bit on best practice in terms of lambing pens? Is it better to do a full wash and disinfectant, or you know, if you were under time constraints or under pressure, that could you know, put down a layer of lime on top of the existing bed and put in extra fresh straw to take some of that pressure off? Or what would your advice on that be?
Thanks, Phil. So I suppose every bit of it's a help. Whether it's fresh straw on its own or whether it's disinfecting between. The gold standard I suppose we'd be looking for would be to clean it all out, sweep it clean, not to pressure wash it, or not to put any water or any moisture into it, to keep the moisture away as best as possible. Then applying your Stalson or your hydrated lime, a good thick layer of that, and then a good thick layer of straw. So I know straw is a bit scarce in the country this year, and the tillage farmers will like it here, but the price of sheep at the minute, a lamb would buy a lot of straw. So it's clean it out, good layer of disinfectant, with that hydrated lime or that, and then a good thick layer of straw. But if that, every step back from that I suppose then is one step less, but it's always a help if we can apply that, a good layer of the lime and fresh straw on top each. It's a busy period, and help can be scarce times. It's all a help, but I suppose it's every step back from that gold standard. And
I suppose it's do the best job you can, and possible, you know, yeah, gold standard, and then as good as you can close to that.
Yeah.
I suppose next one, getting a lot of questions about when you talk about hygiene around the stomach tubes and the lambing equipment. What disinfectant, or what do you mean by washing out the stomach tubes and the other equipment? What would you be using?
So I suppose anyone that is watching, there's a very good video the specialists done there. It's a Let's Talk Sheep video where Michael, Kieran, and they've done it there earlier. Damien's done it earlier this year, where there's a 3-bucket rule for them washing them. There's one bucket of warm water, ordinary fairy liquid, washing in the fairy liquid, then going into melting. So melting that they use for baby bottles or for disinfecting there, washing the melting, and then in the clean water to clean it off again. So just washing all the utensils, not your laminate, your stomach tube especially, and in between each lamb, that you're not putting infection from one lamb passing it on to the other. So, yeah. But that video, it explains it very well.
That video is available on the Teagasc website under those recordings from the Let's Talk Sheep webinars from last year. Just a question there again on some of the reasons for lamb mortality. There was a question there on ewes lambing or ewes lying on lambs, and you know, that was classified as under the accidental death section. You know, would there be any other reasons for that, or was it purely down to maybe space requirements, or would there be anything else that could help to, you know, you talked about maybe preventing accidents?
I suppose the accidents themselves are around that ewes lying lambs. It's getting your lambing pens the right size, the right litter size. So if you have higher litter sizes, more prevalence or more triplets and bigger litters, like you're going to have larger size lambing pens. The use of a pipe down the back, some people use it as a drinker there, one of them 4-inch pipes down the back of it there. It also acts the way keeping the ewe away from the lambs, and an area for them lambs to lie safely in behind it. But the accidents, I mean, we can prevent a lot of the things, or we can reduce the risk of them, but some of these accidents are going to happen whether we live with them in the shed or the. So
yeah, exactly. So look, you can do everything you can, but unfortunately some of those accidents are going to happen anyway. I'll give you a little bit of a rest, Dwayne, and we'll come to you, Caroline, and the questions are still flooding in, so I'm trying to keep up here. I suppose the first one, there's a lot of interest here around the TASA program, so maybe you could elaborate around how does a farmer get a TASA visit? Do you go through your own vet, or will there be workshops rolled out for, well, sorry, it's connected. But will there be workshops rolled out for the rollout of electronic prescriptions for farmers? How to understand them, or how to, I suppose, maybe people that aren't fully used to the electronic side of things.
Yeah, absolutely. I might start with the TASA question.
Yeah.
So the TASA is being run, it's being operated by Animal Health Ireland. And at the moment they are training up all vets. And the idea is that from mid-February, you will be able to register with Animal Health Ireland for the TASA. And then you will nominate the vet that you want to do this TASA, the vet that's going to come onto your farm and develop this parasite control program. So there will be a lot of information and flyers going out from Animal Health Ireland from the start of February as to how you participate in this. And as I said, there is funding for every sheep farmer in the country to get involved. It's a really worthwhile initiative. You're getting advice. You will then be better able to know what the problems are on farm in terms of what parasite burdens you have. And most importantly, what's the appropriate treatment? Perhaps you're overuse, perhaps you're treating adult yolks that don't need it. So this whole TASA program is geared at giving you advice on how to better control parasites on farm. And it will start from mid-February onwards. So there will be plenty of information coming from Animal Health Ireland on that. That's
brilliant. Thanks, Caroline. So that's kind of covered. Sorry, just one question. How would you register for that program? That'll be in that information that comes from Animal Health Ireland. Yes. So that covers that. Yeah. There's a couple of questions coming in here, Caroline, similar type of questions, a little bit of concern maybe. I suppose traditionally, where lambing yos, you have a case in the middle of the night there where a yo needs, an antibiotic or something, because of an issue that has occurred, or a hard lambing or something like that. Could you clarify? I think you mentioned something in the talk there around being able to store a small amount of antibiotic, for animal welfare reasons, and that it's not that you'd have to call a vet in the middle of the night to be able to get that antibiotic, in the traditional way that we would always ensure animal welfare is maintained,
Yeah, I want to be very clear on that, Philip. Nobody is saying that these regulations will require you to have a vet out for every time you have a sick animal. Particularly these yos that may have a difficult lambing. Now, one thing I would like to say is you shouldn't be giving any yo one shot of penicillin. It should be a proper treatment, a proper course of treatment. And the other thing is, if you use proper hygiene, you shouldn't need to give them antibiotics unless there's something seriously goes wrong during the lambing. But at the same time, sheep farmers will be permitted to have 1 or 2 bottles, depends on the size of the flock, of an antibiotic that at their disposal to use when they need to. They certainly will not have to be getting the vet out or ringing the vet in the middle of the night. They will be permitted to have a small quantity available on their farm.
So I suppose the message there really is work with your vet. Your vet will know your circumstances and maybe what might be required for your farm, and that will be permitted.
Absolutely, the vet will decide.
Perfect. There's a couple of questions again then on the antiparasitic side of things, the antibiotics. Couple of questions around, if you have purchased, we'll say, some worm dose prior to the 1st of June, when the regulations come in, can that be used then after the 1st of June without you wouldn't have got a prescription before that? What is the procedure as regards using up existing products that may be on the farm?
Yeah, there's no issue with that, but that's not to say everyone should run out and start.
Obviously. Yeah.
But yeah, there's no issue with using product that you've already had on the farm.
Yeah, and I suppose a similar type of a question, post, when the new regulations come in and you'll have your prescription. I suppose there's a couple of questions coming in there around the area of, can you part fill the prescription? And also then, say, for example, you bought a particular product and the prescription is for 12 months. At the end of that 12 months, if there's still some of that product on the farm, it's still within date. Is there an issue there with regard to the prescription having expired, or can that be used while it's in stock, having got the original prescription? I'm paraphrasing some of the questions, but there's similar type of questions coming in like that.
Yeah, there is no issue if you have some product left over, continuing to use it. I suppose, as I said, the whole purpose of the regulation is that the vet prescribes the quantity that he or she thinks you'll need. So you shouldn't have a huge amount left over.
Yes.
There isn't an issue with using it.
Okay, perfect. Another one then in terms of, can you explain how the wormers or flucicides are recommended? Is it by trade name or would it be by active ingredient name?
On the prescription,
Yes.
you'll have both. You'll have the trade name and the active ingredient.
I suppose where maybe somebody's coming from there is, you know, if they had a prescription for a particular product named and that wasn't available, could they go to the next, you know, similar active ingredient product or whatever?
Yeah, well, at the moment we're working on developing a list of interchangeable products. And
okay.
We've gone to the HPRA, the Health Products Regulatory Authority, who authorize these medicines, and asked them to develop a list. So that's where you will have the potential then to go for a slightly different product, but it will still do the same job. So that list has to be developed, and it's from that list that you would choose an alternative. The dispenser would choose an alternative.
Perfect, Caroline. That's brilliant. It really clarifies. I suppose, look, the message is, you know, I suppose maybe none of us like change, but we can all think of cases maybe where in the human side of things that, you know, there's been issues with people having, you know, treatments maybe that weren't working or whatever, and we have to link that now to, we're doing our bit here to try and reduce that problem. Dwayne, we might come back to you. There's a lot of questions still coming in. Question here, you were talking about the colostrum quality and the importance of it. Would you have any advice there on appropriate feeding rates, you know, for singles, twins, triplets, that to try and ensure that you would have sufficient amounts of colostrum in the yolk to try and minimize these problems?
So I suppose the quality of colostrum is going back to the soya again.
Yeah.
And it's not so much the feeding rate what you're giving them, it's the quality of that concentrate that you're giving them. So you're looking to give a concentrate with 18, 19, 20% soya in it, with soya high up in that ingredient list, and aiming for 100 grams of soya per lamb carried per day for the last 2 weeks of pregnancy. So for the last 2 weeks, you're looking for 100 grams of soya per lamb carried, and I suppose it's again looking that you're buying a good quality ration and not so much in the amount of it, but that you're looking for a good quality ration with soya high up in it for that good quality colostrum again.
Perfect. And just on that kind of note as well, just could we reiterate again? There's a few questions there about stomach tubing. You know, would you be recommending that to try and, you know, make sure that, you know, lambs are getting sufficient amounts of colostrum, you know, in a place where maybe, you know, you're trying to prevent as many problems as you can, and also reiterate again, just what is the quantities of that colostrum that the lambs need to be getting?
So in the talk there, we've looking at 50 ml colostrum per kilo lamb birth weight. So if we take a 5 kilo lamb on average, a 5 kilo twin lamb, we're looking at 250 ml colostrum as soon as possible after birth, definitely within the first 6 hours. And then if the ewe doesn't come to her milk, or she doesn't start producing milk, it needs that another 3 times. So it needs 4 of them 250 ml feeds. And I suppose looking at the type of it, the ewe herself, which has colostrum, being again talking about the gold standard, coming back from that, another ewe in your flock, whether it be taking a sample of her fresh colostrum, will last for a week in the fridge. If you have it chilled at fridge temperature, it'll last for a week in it, and then it can be froze. Subsequently, it can be froze, or I suppose other natural options of cow's colostrum pulled from a pool source, or mixing artificial colostrum through the ewe's colostrum. So 50 ml per kilo of birth weight within the first 6 hours, and repeat that 3 more times within 24 hours.
Perfect. Thanks a million, Dwayne. Thanks a million. Look, I think, lads, we're getting really close to the end here. So thanks a million for all the questions that are coming in. Look, as I said, there was a lot of similar type questions. We've tried to get through as many as we can. There's some questions there maybe that are a little bit more general. I would recommend maybe that if you keep an eye on our Teagasc Sheep page for advice on topical issues at the moment running up to lambing, and obviously as the year progresses, with the changes that Caroline has outlined, and that we will also have extra information. We have our usual sources there. We have our OVcast, our podcast. We have our Teagasc Daily there on the main homepage under the sheep section. And obviously we have our regular updates, and I suppose on the subject of technical information and that, I'm just going to, give a few thank yous here first. I would like to thank our panelists, especially this evening, Dwayne Sheils and Caroline Garvan. Thank you very much for joining us and for your excellent presentations, and for fielding all the questions we've had. Thanks again also to those who contributed to the first part of our conference on Tuesday night. I'd like to say a big thank you to our colleagues in the PR department, as well as our colleagues in the advisory regions for their help in advertising and promoting this event. A special word of thanks needs to go to our online media specialist, Declan McCardle, who was overseeing the live broadcasting of the conference tonight and on Tuesday night, and to Kieran Lynch for his assistance. To yourselves, the viewers, the most important people, thank you for tuning in such numbers. On both nights, we've had huge numbers of people tuning in. Thanks for all your interaction, your questions, your comments. Look, we hope you found the conference informative, and that you've taken some information from it that you can bring home and use on your own farms. And I suppose I will remind people that the recordings from both nights, from Tuesday night and tonight, Thursday night, is available on teagasc.ie, or Tuesday is available, tonight will be available in the coming days. And also there's a copy of the proceedings of detailed papers to each of the 4 speakers over the 2 nights prepared, so there's extra information available there. I suppose, thankfully, with the easing of restrictions, we will soon be able to get back to in-person events. Just something we're all very looking forward to. We look forward to being able to meet you again in person at our Teagasc conferences, on-farm events and open days. And because of recent developments, I can tell you that our Hill Sheep Conference is now going to take place in person in Sligo on the 24th of February in the Clayton Hotel. And if you check out the Teagasc website and our social media channels over the coming week or two, you'll find more detailed information about the timings and the speakers and papers that will be presented at that. So that's a very positive move, and I look forward to meeting you at other events as we move through the year now, that we can get back on the road. So with that, I suppose I'd like to thank you all again for tuning in tonight. Best of luck to everybody starting lambing in the coming weeks, and stay safe. Thank you.